Best treatment for bags under eyes? 48-year-old male with bags that have been there for years, but getting worse. I'm wondering what the best, real cost-efficient procedure would be.
Thank you for your question. You're 48 years old and you're looking for a cost-effective way to treat the under-eye bags. Well, I think that the idea of doing something cost-effective definitely resonates with the solution that I would suggest for you. The under-eye bags that you have is based on an anatomic issue called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyes pushes forward and creates these bulges. So the solution to this issue is a procedure called a lower eyelid blepharoplasty. Now, for most male patients, we generally do this procedure from the inside of the eyelid, and that approach is called the transconjunctival approach, or we call it transconjunctival blepharoplasty. That's in contrast to an external approach, what we call a transcutaneous blepharoplasty. The idea is to avoid an incision on the outside unless there is any extra skin. And generally, even in older patients, we don't find that much extra skin. It's kind of a paradox, but there's a distinction to be made between skin that is excess, which is redundancy, versus skin that's wrinkled and thin, which is a function of skin quality. You don't treat skin quality by removing skin. It ends up causing problems such as the ectropion or eyelid pulling out or pulling down called eyelid retraction. So typically for a person like yourself, a man 48, we would do a transconjunctival blepharoplasty under local anesthesia with light IV sedation. This is something that we have developed over the 20 years I've been in practice so that our patients avoid general anesthesia and are able to go back to work quickly. By doing the procedures in our own facilities, we have dedicated staff and we have a process and protocol to expedite the whole process so that the patient feels comfortable and everything that can be done for them is done in a timely way. I'm always impressed by how good a majority of our patients look after 1 week, and a lot of times they have so little bruising and so little swelling that it's just great, and it has to do with thinking through all of the steps and follow through on the protocol of aftercare at home. So as far as cost effectiveness is concerned, once that's done, it's done. Being in practice for 20 years, I get to see my patients throughout this time, and I see 5, 10, 15 years later, the eye bags are still gone, and maybe other areas of the face, of course, need attention for aging changes, but that result is something that will last a long time, and I think that makes it a very cost-effective investment, especially in contrast to doing something like injectables, which would require maintenance. But really, for under-eye bags, there really is no injectable alternative that'll be worth anything for your situation. So meet with qualified, experienced cosmetic surgeons. As a specialist, I always recommend people find specialists, people who do eyelids really, really well. And find someone that you feel comfortable with and you feel that it'll be a cost that you can handle, and move forward. I think it'll make a big difference for you, and it'll literally change the overall facial expression. People always who have bags under the eyes are always assigned these qualities such as lack of energy, fatigue, and people always think that they were drinking and not sleeping enough. Doing the lower eyelid bags can really have such an impact. I always say it's like doing a facelift. It really just brightens up the whole face. So I hope that was helpful. I wish you the best of luck. Thank you for your question.